Hi, this is Dr. Desmond White, gastroenterologist. Today I want to share my thinking process of a patient that I've been seeing so that you can learn how to manage a patient with severe dementia uh, with a feeding problem. So dementia is a common problem in our society. People estimate there are 70 over million of demented people worldwide. Roughly several percentage, less than 10% of the 5 to 10% of the elderly may have dementia. It is a difficult problem. They go from mild, moderate, and severe. Mild dementia patients, they forget, they are a bit unstable, and eventually, when they get severe dementia, then they may have a very poor memory. They may have even difficulty in swallowing. In fact, once they have difficulty in swallowing, it is a hallmark, it's the beginning of a very bad process, which is severe dementia. We actually need a lot of coordination, muscle, nerve, kind of function for us to swallow. When the brain is damaged by dementia or by a previous stroke, the coordination of the nerve and the muscle at the swallowing apparatus here may not be good, and they have a swallowing problem. So a lot of dementia patients, they can't swallow very well, can't chew very well. As a result, they lose weight, they don't take in the food, they don't like to eat. And sometimes when they eat the food, instead of going to the esophagus, they go to the lung and they cause pneumonia. So when we have someone that have a severe demented patient with a feeding problem, there are many questions that the caretaker have to decide. Obviously, if someone already has dementia, the patient cannot make their own medical decisions, so the family member, the next of kin, usually their spouse or the eldest daughter, eldest son, or the group of them will have to decide. So the question number one is whether they should put tube feeding or continue to feed them. Tube feeding means put a nasal gastric tube through the nose, go through the back of the mouth, go to the esophagus, go to the stomach to feed them. Nasal gastric tube feeding, or whereas nose feeding. Actually, most doctors, including myself and the American Geriatric Society, recommend that if patient is not too bad and you have the facility, the manpower, the expertise, the experience, and the patience, not patient, patience, then you hand feed the patient slowly. You can hire a domestic helper or the spouse or one of the family member, sit down with your loved one, feed them porridge, rice slowly, chew slowly, swallow slowly. That is a better way to feed them because they can chew the food, they can enjoy the food, enjoy the texture, enjoy the taste. But you need someone who is skilled and patient, a caretaker to feed them. So hand feeding is probably the first choice. But if you don't have the facilities, don't have the personnel, or the patient is so badly demented that they cannot even swallow, then you have no choice. The decision that family have to take is whether we should tube or not to tube. A tube means put the nasal gastric tube from the nose through the solid to the stomach. It's not difficult to put in. Many family doctor, home care specialists can put it in. I put it in for my patient in the ward. We do an X-ray to be sure we are there, and then we can feed them. Unfortunately, when you do a nasal gastric tube feeding, the tube is very thin. Because a big tube means it goes through the nose, it becomes very uncomfortable. So we choose a smaller tube to go in, a soft one, so there's less discomfort. But the small tube, the good thing is that it's less uncomfortable. But the bad part is that when you feed milk, the milk will coat the lining, and some of the milk that we feed are very viscous. They will choke it, and they will block the tube. Also, when the tube go in here, the tube will block the sinus drainage, so they tend to have more sinusitis, no infection of the nose. They may also have some inflammation of the esophagus because the tube has to go through the esophagus. And some families try to serve medication through the tube, and they have to pounce, they have to really mince, really make them very fine, granular kind of thing, and they feed through the feeding tube. When they do that, then they would also sometimes choke the tube. So that's not good. So family have to decide, should they hand feed or should they do a tube feed? As I say, we will prefer hand feeding if we have the patience and the experience and the knowledge and the skill. If not, then a lot of time we just put a nasal gastric tube to feed them. It is uncomfortable, it goes to the back of the nose. It can get choked every 1 month or 2 months. It's quite common. You have to keep flushing with fluid. And when you walk outside, it is unsightly. Imagine carrying your grandmother out and she got a little tube, everybody may look at you, okay? So it's not good. Besides the nasogastric tube, there are more solutions that they call the percutaneous gastric feeding. Percutaneous gastrostomy tube. That means the tube goes to the outside, go through the skin and the muscle, go in the stomach wall, and feed to the stomach. Should the patient keep the nasogastric tube? Should the patient put a feeding gastrostomy, percutaneous gastrostomy tube? I will talk about it at the next video. Thank you for watching. This is Dr. Desmond White again. Thank you.